Hi, are you Taylor?
Hi, yes.
Hi, Taylor. My name is Jill Bitz. I'm the occupational therapy student today, and I know that you've been having some problems with osteoarthritis in your left hand and have been having some pain and stiffness when you've been trying to wash your hair and get ready in the morning. So I thought today would be a good day to teach you how to use the paraffin bath. That would be a great tool for you to use at home before you get ready in the morning and to help decrease that pain and stiffness. It would be really beneficial for you. After the paraffin bath, we're also going to do some activities kind of stimulating you washing your hair.
Okay.
Does that all sound okay with you?
Yeah, that sounds great.
Okay. Now there is a chance that you could get burned, but we are going to be using a thermometer to measure the bath, and also going to be making sure that you're not touching the sides or the bottom of it, so you'll be safe. Now the wax should feel comfortably warm, but not hot. In order to do this bath, I want to make sure that you don't have any impaired sensation. Is that correct?
Yeah, no, I don't.
Okay. And you don't have any problems, any adverse effects to heat?
No.
Okay. And you don't have any acute inflammation or edema, it looks like? And there's no chance that you could be pregnant?
No.
Okay. And do you have any problems with bleeding?
No.
Okay. And have you had a blood clot?
No.
Okay. And any infection or tendon or ligament repair?
Mm-mm.
Okay. And you don't have any advanced cardiac disease? Okay. And no problems. And based on talking to you in your history, I know you don't have any impaired cognitive state.
Right.
And then you don't currently have rheumatoid arthritis?
No.
Any flare-ups or anything like that? Okay. So the next thing I'm going to do is just take a look at your hand and make sure that you don't have any wounds. It's really important that you don't have any open wounds putting it into the wax, because that could be really painful.
Right, yeah.
So I'm just going to take a look at your hand. So it appears that you don't have any sores or wounds. I am going to check your sensation. So if you could just put both hands out for me. Does this feel the same?
Yes.
Does this feel the same?
Yes.
Does this feel the same?
Yes.
And does this feel the same?
Yes.
Okay. And are you currently on any medications?
No.
And could you tell me where you are right now?
Yes, University of St. Augustine.
Okay. And can you tell me where you graduated high school at?
Yeah, Palaca High School.
Okay, great. So this treatment does take about 20 minutes, and it's something that would be really easy for you to do at home. Now what I'm going to have you do is wash your hands and then take off any jewelry. You're not wearing any today,
Right.
But make sure at home that you take off any rings, bracelets, or watches before you put your hands in.
Okay, great.
So I am going to be giving you this bell today. This is just for if I have to walk away for a minute and you have any issues, you can ring this bell.
Perfect.
You shouldn't feel any pain, and again, this should just feel warm, but not hot.
Okay.
So what's going to happen is we're going to first kind of get out all your materials. So this bell. So we're going to use this mitt right here, and I'm sure you have an oven mitt at home that you could use. This will kind of be actually one of the final steps. And we're going to use plastic wrap that you probably have in your kitchen.
Yeah.
Okay. So we're going to get out 2 sheets. And we just want to make sure these sheets are bigger than your hand, kind of probably double the size. And then we're just going to lay these out straight. And this is something you definitely want to do before you dip your hands. Okay. I'm just going to lay these out. So So all laid out. So how this is going to work is that when we dip your hand in, I want your fingers slightly apart. We don't want to be like fidgeting or moving your hands around because that will crack the wax. So we want to keep your hand nice and still.
Okay.
And we don't want you to touch the sides or the bottom, just to make sure there's no chance of burning. And the machine is already plugged in. That will be something you'll have to do at home, so you'll have to do it near an outlet.
Okay.
And we are going to use the thermometer to measure to see what the wax is, and that's really important that you do before sticking your hand in.
Right.
So we can go on over to the machine.
Okay.
Okay. So we first want to take the lid off, and then we're going to be using the thermometer to make sure if yours has a cap on, the cap is removed before you stick it in. You're just going to put it in. So when you're doing this at home, when you're going to be kind of getting the wax typically in like blocks or little pellets that you'll just throw in here and melt, and you can see the lines in there.
Yeah.
You want to make sure that it's at least above the line measurement in there. That way you have enough wax where you can dip your hand in easily without hitting the bottom or sides.
Okay.
So this should just take just another minute or two to warm up. You can see it's still slightly going up. And just remember, we want it between that 126 and 134 range.
Okay.
So it looks like it's stocked right now. So can you read this temperature for me?
Yeah, about 130.
Great. That's right in the range we want. So what we're going to do, we're going to have your left hand out, and remember your fingers slightly apart, and then we don't want you to touch the sides. So each time you're going to be dipping it in, pulling it out, letting kind of let it stop dripping, and then when you put it in again, you want it to go slightly more shallow than the time before. So kind of start off about right here on your wrist first, and then each time go slightly more shallow. And then we're going to dip this between 7 and 10 times.
Great.
Okay? So we're going to start dipping in. Good. So there's one. Let it dip. 2. 3. 4. 5. 6. 7. 8. 9. And one more. 10. Good. So now that it's not dripping, we're going to take it over here. And we're going to lay it flat on the sheet. Good. And then we're going to wrap your hand in. You want to be careful on this part not to kind of move your fingers around so it doesn't crack the wax.
Okay.
Make sure it's all covering. And then we're going to use the second sheet again to just make it sure nice and tight. You can let it go here. How are you feeling right now?
It feels good.
Okay, good. And then we're going to put your mitt on. I'm going to slide that in, and then I'm going to have you take a seat right here for me.
Okay.
And it's at a good height. I want to keep it kind of above your heart so that you're elevated.
Okay. Great.
So I'm going to give you this bell here, and you're in a good position. How are you feeling right now?
It feels very good.
Good, and we're going to keep this on, like I said, for 20 minutes.
Great.
So now that it's been a few minutes, how are you feeling?
Good.
Is it still, are you feeling warm or hot?
Just a little warm.
Okay, great. That's exactly how it should feel, the warm but no hot or burning sensation.
Right.
Okay. So now that it's been 20 minutes, we're going to remove this.
Okay.
So you're just going to remove the glove first. And then the wax may be a little slippery, but it should come off really easily. You can just pull off the plastic wrap and the wax all together.
Okay.
Good. So now we're going to throw this away, and then we're going to make sure we unplug the machine.
Okay.
So I'll be right back. I'm going to throw this away.
Okay.
So now that we finished with the wax, first off, do you have any questions for me?
No.
Okay. So now we can, before we move on to our activity for the day with washing your hair, I'm just going to go through some instructions that I have for you so you can do this at home.
Okay, great.
So this is something that you can use every day, kind of as needed, and it would be great to use it in the morning, when, especially if your hand is really bothering you, if it feels really stiff and painful. That way you can use that wax for 20 minutes and then start doing your activities, your morning routine.
Right, okay.
So some of the supplies you'll need is, of course, the machine. You'll need the paraffin wax, which usually comes in blocks. You're going to need the thermometer to measure. You're also going to need an outlet to plug it in. And then you'll get your 2 sheets of plastic wrap out, an oven mitt, and then just a chair and table so you're comfortably
Right, okay.
set. So before you start any of the wax, you just want to make sure that you don't have any open wounds on whatever, with the hand that you're dipping into the wax. It's really important that if you do, that you don't do the wax treatment.
Okay.
And also I just wrote you kind of a list of some of the other things we talked about, like the impaired sensation or the inflammation and edema. If any of that stuff changes and is present, you definitely don't want to do the paraffin wax.
Okay, gotcha.
So to start off, you're going to get your machine, and you do want it on a flat, heat-resistant surface. You're going to have it near an outlet since you will have to plug it in. Before you do plug it in, though, you want to put the wax already in it. That way you don't get that like burning smell.
Right.
And then the wax will start to melt probably within 5 or 10 minutes. And then when it is melted, you want to get the thermometer. And do you remember what degrees we said we wanted it
Yeah,
on?
it was 126 to 134.
Right, exactly. So you want to make sure that it's not any higher than that, since that can increase the chance that you will get burned.
Right.
And that's
Okay.
what we want to prevent. So you already, you want to lay your sheets and gloves out. Make sure you wash your hands, remove any jewelry that you may be wearing that day. Remember, when we're dipping it in, we want your fingers slightly apart, and we don't want to touch the edges or the side of it. And make sure you keep your arms really still, so you don't crack the paraffin.
Gotcha.
And just always remember, when you're touching the wax, it should feel comfortably warm but not hot.
Okay.
So after you've removed your hand from the first dip, you're going to kind of let it stop dripping, and then each dip after, you're going to do it slightly less and less on your hand.
Okay.
And you're going to do a total of 7 to 10 dips.
Okay.
When you finish that last dip, you're going to come over to your table and use the plastic wrap to wrap your hand all up so any of the wax isn't exposed. And then you'll put your hand in the oven mitt, and you'll keep that in for about 20 minutes. And then you can take the oven mitt off and remove the wax and the plastic wrap kind of together. You saw how I kind of just pulled it off, and it came all off at once.
Mm-hmm.
And just toss that in the garbage, and just make sure that you're and make sure that you unplug the machine.
Okay.
Now, since we just finished the treatment, I know you do have a little bit of redness. Now, that is completely normal. but that will go away, and so you can kind of expect at home you may see some of that same redness, but it should go away soon, and that's completely normal.
Okay, great.
Do you have any other questions for me?
No, I think I'm good.
Okay, great. So after you finish kind of going through all these directions and you perform the wax treatment, then you can start doing the other activities we talked about, like using the hairbrush and your straightener and using your toothbrush and getting ready in the morning.
Yeah, okay, great.
Okay, thank you.
Thank you.